talk shows, lectures, documentaries, discussions, arguments, information, education, entertainment, infotainment, music, drama, theatre and more. Only on Radioactive 90.4 megahertz. Get active. Stay tuned.
Hello, this is Preeti. The Preeti Bhuyan Talk Show is a platform to speak out your mind. I feel every person has something wonderful and unique inside their mind which may be worth listening, and it may be motivate or inspire others. Preeti's talk is about fitness, inspiration, motivation, sharing knowledge and celebrating womanhood. Stay tuned, stay connected. This is Preeti with loads of love.
Welcome to the Preeti Bhuyan Talk Show. I bring people here in front of you who has something beautiful in their mind, in their heart, which may motivate or inspire you, or maybe it's worth listening. I am the host Preeti Bhuyan, and my today's guest is Dr. Ashu Shah. Dr. Ashu Shah is a senior consultant and director of Asian Healthcare. She has sponsored oncology treatment free of cost to many patients. Dr. Ashu Shah appeal people not to stigmatize COVID virus disease like cancer and TB patients were stigmatized in the early stages of the disease. Rather, provide moral support to the patient. Dr. Ashu, welcome to our show once again. And I am really privileged to talk to you. It is really nice that you are giving information and helping us to know more about the pandemic, how to take precautions and how to stay safe.
Thank you, Preeti.
I want to ask you how the situation is and now how it is going on.
The situation is better now than earlier, I can say,
Okay.
because we have been giving back people updates like how to take care of home isolation and how you can take asymptomatic patients there at home. Because asymptomatic patients, since I think we have been seeing they have symptoms like fatigue, body tiredness, than fever.
So you mean to say that things are getting better now? No need to panic.
We can reduce going hospitals unnecessarily because making hospitals overcrowded. So what we do, these asymptomatic patients, they can take online consultation.
When people are coming to you for a treatment, with what kind of symptoms they come to your place?
So we get patients with symptoms like fatigue more. They will be having the body aches and tired. They feel like sodium levels are going down, fluctuation. Blood sugar levels are fluctuating, and some patients, very few patients, oxygen saturation is going below 92. So those symptoms are currently more metallic taste, like they eat, but they feel it's a tasteless. So chills, diarrhea. So these are the 15-20 days update. We have been getting patients with symptoms like, and most of patients were asymptomatic. These are all asymptomatic, and I feel like asymptomatic we can treat at home and give them the self isolation kits and to reduce the hospital crowd who are unnecessarily crowded because hospitals are already overwhelmed.
Okay. So here, just interrupting you, what do you mean by asymptomatic patient? How do we understand that?
They expose outside.
Okay.
And sometimes, all of us going out for work or anything. So we may feel sometimes tired, we feel fatigued, we feel no smell. We can't smell also. There will be loss of smell, metallic taste, fatigue. These causes will be there, main. So if we feel any indication of these things, so we should report to the doctors, and they will be taking care online. There are online consultations. If anybody needs help, we are privileged to give support at night time or daytime. These are the patients with blood pressure. They have blood pressure. They have right now fluctuation in BPs. Patients with blood sugar, they have the fluctuation in the blood sugar. So these are the symptoms. These things are at home, and these are asymptomatic patients. Everyone's coming out now. I am having this thing, and I have to go to hospital and do things like that. So they should not get panic. And these asymptomatic patients absolutely can be taken care at home.
Okay.
There is a COVID-19 and COVID-19 with pneumonia. COVID-19 with pneumonia, they have symptoms more. Their oxygen fluctuates. Like it will be very, it will fall out below 90. So they definitely need hospitalization. They need the attention more who are COVID-19 with pneumonia, and they'll be taking at least 4 to 6 weeks to get well. And so we should have the regular checkups of vital oxygen levels will be low. If it is means below 90, it is 85, 82. So definitely they have to be in the hospital. And if we have the oxygen saturation up to 95, then no need to go to hospital. We can take care at home with the asymptomatic treatment. There are kits available for that, and even we are also providing those kits. And if COVID-19 with pneumonia, they have oxygen saturation very low. So pulse oximetry we have to keep at home and check the oxygen levels. If it is coming below 90, then they have to report to hospital. If it is 95 and they have the fatigue, they have the metallic taste, they have the loss of smell, they are feeling fluctuation in BP, so can be taken care at home. So these things, maintaining the blood sugar, and everything can be taken care at home. So who needs hospitalization is COVID-19 with pneumonia patients, immunocompromised patients like cancer patients, chronic kidney disease patients, and chronic neurological patients like stroke, Parkinson's, Alzheimer's, and chronic obstructive lung diseases, as I discussed with you earlier also, bronchitis, asthma, serious heart diseases. And these are the serious patients because we see right now hospitals are crowded. Why is the reason? The reason is asymptomatic patients are getting panic. So they can, those patients can be taken care through online consultation. And if fever is shooting up above 102, they should bother. If oxygen saturation is going below 90, they should bother. And after this COVID-19 pneumonia, they comes home, we should give them well ventilated room. A room should be little bit ventilated and it should be separate. Everything should be separate. So they should be taken care well, and people around, they should not get panic. Now we will get go because already this patient has been treated at hospital. And there's a screening for COVID-19. One is the antigen antibody, and one more is the RT-PCR. RT-PCR, it shows sometimes like fluctuation because if we do at 6th day and we will get 9th day report, sometimes it will be fluctuated, positive, negative like that. So because the virus will be dead. So people should not get panic why it is now negative. I was first positive or I was having these symptoms. Patients.
So one suppose, Dr. Ashu, here I want to ask you, one suppose the person is positive, but after like some days, second test is negative. Is it there is a chance to come back again? Can he become a positive again?
He will not be. It won't recur. It won't recur. Absolutely, they have to take care of immunity, and they have to do the light exercise and high protein diet.
Okay, high protein diet.
Yeah, high protein diet. Apart from having the carbohydrates, they can add high protein diet and light exercises and well ventilated home.
That means fresh air are very important.
Very much important. Absolutely. Yeah. And home isolation is they should absolutely wear masks. They should sanitize the hands and they should separate from the family. But family also, I appeal every family and every friends. They can do many things if they are in home isolation. We should not stigmatize the disease. Okay, we should provide the moral support. We should take care because psychologically they go down. We should break the taboos. We should break the stigmas around because we see every patient. It is very tough for every consultant to treat also the disease and to give the psychological support also. So I request to all of family they should give the moral support. So it should not be like COVID-19 is a disease. It is a deadly disease. It is a life-threatening disease. No. So if we take a self-isolation precautions like and sanitizing hands and then physical distancing, and nothing will happen to anyone.
Okay. Mm-hmm.
Yeah, people, we should take C plus. It has a zinc, it has a vitamin C, it has a vitamin
Okay.
D3. It is a triple in one.
Okay.
So we can have once in a day this one tablet.
Once in a day, C plus you are saying about, right?
Yes.
Okay,
Yeah.
done.
And the essential emergency things we have to keep in the home if we have these patients. One is the pulse oximeter.
Mm-hmm.
And if we have a pneumonia patient or COPD or cancer patient, they should keep oxygen concentrators at home.
What is that? Can you please repeat once again? Okay.
Oxygen concentrators.
Okay. Do we get in the market? These things are available in the market?
We are keeping, through my foundation, we have been giving many people in like home isolation kits in cantonment zones. So who are right now, like night time also they call us for oxygen concentrators. We send them.
And who will give those instruction how to use it? Is there any instruction manual or anything is available, or is helpline number?
Whenever they will be having the oxygen concentrator at home, they will be buying it. It's nowadays very easy. It's very easy to just to use like a cooler.
Okay.
It's not that tough.
And I am really privileged to talk to you always. Thanking you from bottom of my heart. Thank you so much.
Thank you, dear. Thank you.
She said, break the stigma and taboos. COVID as no more deadly disease, and such patients should be treated equally as other disease. She is constantly working to protect cancer patients and senior citizens from COVID-19. She is supporting poor economic citizens, needy, to reduce the unnecessary crowd to the already overcrowded hospitals. Cancer patients should not discontinue or stop treatment. She even concentrating more on them as they are more prone to get infected. At the same time, she asked not to panic but appealed to follow the norms like physical distancing, wearing mask, hand wash, and follow hygiene. Stay safe, stay healthy always.
This is Preeti from the Preeti Bhuyan Talk Show with Radioactive 90.4 MHz. If you have any suggestion or want to share your own incredible story, you can reach us out on Facebook, Insta, Twitter, and YouTube. Until next time, this is Preeti. Keep listening, keep loving, keep inspiring.
Radioactive 90.4 MHz, Bangalore's first community radio station. Listen up, listen up, listen up. Get active.